Dr. Birungi, in fact, Deusdedit Birungi, born from Kisoro, but I live in Kampala.
Okay.
Trained medicine from Barara University, Science and Technology.
All right.
From 2012 to 2017. I had my first clinical experience, or what others call internship, at Zambia Hospital. So I was able to, from Zambia, I was registered as a doctor to practice. So, and since then, I've been doing a variety of projects and activities, but also in this realm of muscle dystrophy, I discovered early on in life that I was a bit different from others. And in fact, my parents initially thought it was polio, so they would go to different hospitals, try to ask for polio and whatever. But my personal experience at the time, even without any knowledge of medicine, I would feel the explanation the doctors were giving me was not enough, or was not sufficient, because I always felt it was just weakness. I was just weak. Not that maybe my bones had a problem, or maybe that I had polio, some sort of weakness. I kept telling my parents, no, I don't think this is polio, this is something else. So, and because I always felt that the explanation they gave me, even without any kind of knowledge of medicine, when I was in primary school, this is something that is not polio. Then, as time went on, I kept noticing that I was actually getting weaker and weaker. So I was trying to find out, why is this happening? So I remember when I was in Form 6, I think, Form 6, I met a doctor from Zambia, named Dr. Peter Chigonya. He's the one who saw me first, and at that time, I used to go to him to get, at school they used to ask for those, every time they would ask for a medical report. So I used to go to him, and then we would talk and have a chat at length. And I was always telling him how I'm interested in doing medicine. And the primary motivation was that I needed to learn more about my condition, so that when I can understand it, given the experience I had in childhood, primary school, when I first noticed that I was different from others.
Yes, sir.
The kind of explanation the doctors were giving me wasn't matching, so I decided to say, let me go and study this thing myself, so that if I ever get a patient who is like me, I'm able to explain to them what exactly is ailing them and how they can be able to live with it comfortably. So Dr. Peter Chigonya was the first one who said the word muscle dystrophy. And the moment I heard it, I was at peace, because I knew that finally I have gotten a diagnosis for my problem. And when I began reading about it, I was in senior 6. When I began reading about it, some of the terms, medical terms, were very technical, I wouldn't understand it. But at least the explanation they gave matched with my own experience. So I was able to put these things together. I think my journey with trying to understand muscle dystrophy, muscle weakness, begins from my personal experience, but also from Dr. Peter Chigonya. And I remember when I was going to university, he wrote for me a recommendation. When the results came out, I performed well, and I got admitted to medicine on government scholarship. But then, when I was going to go to Makerere, I met, there's a lady I met, I don't remember her name. She used to work in the Senate. So she's the one who told, I remember her telling her colleagues that, let's push this boy to Mbarara, because Mulago would be very difficult for him given the physical challenges he has. So I remember I went to Dr. Peter and I told him to write for me a letter. He wrote for me a letter from Zambia Hospital that was addressed to that lady at the Senate. That's what they used to send me to Mbarara. And I remember when I traveled to Mbarara and then telling the academic registrar, Mr. Wazirake at the time, that I've been admitted here for medicine. I could sense a bit of frustration on his face, saying, why is Makerere always sending us students that we have not admitted on our own scheme, but we've admitted on their own schemes, but they are not getting them there. And then I remember sitting him down in his office, and he was trying to explain to him why this lady, particularly from Makerere, recommended that I go to study from Mbarara, because the terrain in Mbarara was, I would say, more friendly, given my condition. There was a bit of protest from the deans, and I remember I also went to the dean's office that very day tried to convince them. And in fact, in the evening, they had not confirmed my admission. And they told me that, they asked me if I could actually do pharmacy. So at the time, I really had no information. The difference between pharmacy or medicine, or how everything works. And my mind was locked in doing medicine. So they realized the frustration in my face, I think, and decided to say, let's keep the admission as medicine. So I was able to get admitted in medicine. And I remember the first semester, on the registration form of the class, my name was handwritten. And because it was handwritten, they gave me a registration number of 41. At the time, Mbarara was only admitting 40 students on government scholarship, and they gave me number 41 to indicate that I was actually an extra student who had come from Makerere. The second thing about that experience of getting admitted to Mbarara was that the first semester I was on probation. I had been told that if you do not perform well this first semester, we are going to either demote you or give you a different course or send you back to Makerere. So I remember I wasn't really on pressure because I knew I would perform, but that was the condition that they had also given me. So I remember that first semester, I finished it when my name was still handwritten in the class list. And the reason I think it took time to collect because the system was not reflecting me. So there was a bit of back and forth with Makerere to make sure that my details of my admission had been admitted to Mbarara University. And also to make sure that whatever I required for that admission was also processed in time. My admission came late because the admission was confirmed just a week before reporting, so there was also a bit of that. So that's a little bit about my background from Mbarara University and how I got admitted there. The studying was really smooth. I can't say I got any challenges. And I remember every time I met fifth-year medical students or fourth year, I was always asking them, do you know muscle dystrophy? Do you know this? And most of the time they would tell me, what is that? What are you saying? Then I would begin explaining. But you can imagine a student who is in fifth year almost qualifying as a doctor, or a student in fourth year who's almost qualifying as a doctor, getting a first year asking them about questions and they don't understand it, or they have an idea but they don't know what it is. So that was also pushing me to say, most people don't know about this condition, or the curriculum teaches us about muscle dystrophy, but at undergraduate level, now that I have become a doctor and I've gone through the system, I have come to understand that the curriculum just hints on it. So for people who have detailed knowledge about muscle dystrophies or muscle weakness, most of them do it at either as a master's after maybe they have done their pediatrics or they have done neurology, and then they begin trying to understand. And most others who really understand it do PhDs in this subject. Because I've been reading extensively about it, I've also read about the kind of treatments people have, the kind of experimental therapies that are ongoing. I've also gotten in touch with so many of those companies. One of them is Sarepta Therapeutics, a US-based company. There are others who are doing other treatments, but most of them, you see, when you approach a company as an individual and a company that does not have any presence in Africa, it becomes difficult for you to actually engage it without having any institutional backing. And that's exactly what they told me. Sarepta Therapeutics told me that they could send us experimental treatments. There's a tepresine that they are selling, which is a drug that is for managing Duchenne Muscular Dystrophy. But they've told me that for them to be able to work with us, we need to do an institutional partnership. Institutional partnership, I mean that maybe Coast Hospital or Mulago Hospital writes to them and say, we have this kind of program, can you support us in this way? So at an institutional level, they're able to understand, and then that program is done. But of course, as an individual, I can't do it. We need everyone involved to be able to also push these institutions so they can participate. The biggest challenge, of course, is mobility. And on a personal note, mobility is not really my biggest problem. My biggest problem is that the nature of the disease is progressive, so it keeps getting worse. So if I was able to walk properly, after some time, I will need a walking aid. After some time, I will need maybe a wheelchair. After some time, even a wheelchair may be difficult. So that is the biggest problem. Of course, thinking about it, it can knock your mental health out of proportion.
Yeah.
Thinking about the different activities, and every time I'm talking about the walking aid or the need to have walking support, you think about the other personal activities, or let me say activities of daily living, that get compromised because of this weakness that is progressive. So you can imagine if maybe you're able to wash for yourself, or you're able to bathe yourself, at some point you're going to need someone to do that for you. And so, of course, in our current setting, it becomes, because some of these things are very private, you wouldn't want someone else to help you, but you have no choice to let someone into your personal space, so they're able to help you do this kind of thing.
Okay.
So one would need very strong family support, because without that, life can be extremely difficult. How do I keep myself resilient? At the end of the day, I've immersed myself into reading about these conditions. I know I may not predict for myself what is going to happen today, tomorrow, or the other day, but I know over a long period of time, I have an expectation of what might happen. So for me being a doctor myself, I'm not going to lose hope, because if I do, then what is going to happen to the patient who may not be aware of his condition, who may not be aware of how the condition is managed, who may not be aware of where they can access treatment, or where they can get support if they need it. So that's what keeps me going. And I remember, maybe if I digress a bit on a personal note, when I had just finished medical school, I used to get, towards the end of my medical school, I used to get frequent chest pains, and every time I would get cough, it would take very long to go. So I was always asking myself why. In fact, at some point I thought, is this TB or is this something? I remember doing tests for TB and they were negative. I was always thinking to myself, what could be the problem? So later on, I just got a thought. I used to get some particular chest pain that is characteristic of like heart disease or heart failure. So I was always asking myself, but I'm still young. Why am I feeling like this? Of course, I did not know that this disease also had that component, heart disease. So I remember I went to, that time it was Platinum Hospital, met a cardiologist there, and because I had seen him somewhere, I told him I was also a doctor. He told me, no, I don't have to charge you for this test. Let me do it for you. So when we did the heart tests, we did the echocardiogram, we did the electrocardiogram. So once those came out, I actually noticed that I had heart failure. And the experience that I already had going through Sunday Hospital, the kind of patients I was seeing, the kind of tests that we're doing for different heart patients, I was able to compare my tests with those of the patients, some of the patients who had admitted. And so it felt like, man, I'm going to die tomorrow, because when I read the echocardiogram report and compared it with some of the patients we were admitting, some ending in ICU, some ending in the high dependency units, basically heart failure patients who were critical, and comparing it with my echocardio report, which was way worse than what they had, I was really scared. So I was worried about it. But I remember I got encouragement from one of my supervisors, who is also a cardiologist herself, and she was able to encourage me to keep going, and so we started treatment. So Professor Dadela, and we had a bit of engagement, and was also encouraging me. So that was like a point to say, no, you cannot give up now, because if you do, then what will happen? At the end of the day, you know what is going to happen. So you basically have to do what you can do with the abilities that you have. If the abilities are normal, that is okay. But at present, whatever you can do, just keep doing. So that's what keeps me going. So if you're a patient that has been diagnosed with DMD or suspected to have DMD or any kind of muscle weakness, the first thing you need to do is get a hospital that is competent, that has the competences that can take care of you. Muscle dystrophy is a disease that affects muscles specifically, yes, but it also affects various systems. So you need to have doctors that are from doctors and other health workers that are from a wide range. So you need a primary doctor. This is the doctor who is always maybe going to be seeing you, or maybe if you get any complication you're going to run to. You will need to have a physiotherapist, because primarily right now muscle dystrophies don't have cure. Physiotherapy is the cornerstone of care. But then you also need to have like cardiologists, like myself. I was able to get one who helped me discover that actually I also have heart failure, which must be managed. You need to have maybe nurses or someone who, every time you need something, they're able to run by you. Then the social support from the family. If you can get a person who can help you do those activities of daily living, help you manage life around you. If you stay with family, or maybe if you can even afford a maid, but you know the subject of maids is something that is a bit complicated and complex because people are different. But if you're lucky to find someone who can understand you and is able to help you, then that's how you can be able to manage. But that's generally, that's my advice. We look forward to having positive engagements with you. We're basically looking at all people who have muscle weakness of any kind, because for a normal person or a lay person, it may be difficult to know this is muscle dystrophy, or this is myopathy, or this, or whatever kind of muscle disease. So anyone who has, sometimes they can even be nerves that are presenting as muscle weakness. So anyone who has weakness, we should be able to identify them in our communities and refer them to Coastal Hospital that is located on Entebbe Road. It's a specialized hospital that takes care of basically muscle weaknesses, neuropathies, and other diseases related to movement or to motion or walking, something like that. So that's the message I have for everyone out there. So if you have a patient or you know someone who has that kind of related illness, please refer them to Coastal Hospital so they can also be helped, but also we create awareness around the community around us for better care for our patients. I have a social media handle on X. It's Birungi Deusdedit. If you search, you're able to see that.
Okay.
I have the same on Facebook. I have the same on Instagram. So you can be able to share and engage. I also have a YouTube channel, bidahealthcare.com. So you can be able to also follow up some of the posts that I've been doing. Mostly we've been talking about functional medicine, so eating healthy, being well, but we're also now going to include a component about muscle dystrophy. We also have a website, bidahealthcare.com. You can be able to go there and see some of the posts we've made about different lifestyle diseases, muscle dystrophy or muscle diseases, and then also access to some of the doctors and specialists that may be interested. Thank you so much.